Good evening, everyone. My name is Jessica Camarillo, and my capstone project is a literature review on the connection between yoga as an adjunctive intervention within a partial hospitalization treatment program for adolescents. Yoga has a long-standing history as a spiritual and physical exercise. In recent years, there's been a shift in the understanding of yoga as an intervention for mindfulness and mood regulation. This literature review is focused on an adolescent population, as this was the population I worked with throughout my internship placement. Adolescence is a transitional age of development which can be experienced with anxiety, depression, defiant behaviors, impulsivity, and difficulties with emotion regulation. Yoga encompasses an opportunity for adolescents to continue their growth and awareness of their body and mind. The duration of my internship was at a behavioral health hospital within a partial hospitalization program, abbreviated PHP. Adolescents admitted were between the ages of 12 and 18 years old, and often presented with depressed mood, lack of motivation, difficulty with concentration, racing thoughts, panic attacks, flashbacks, anxiety, and substance use, in addition to behavioral symptoms such as risky behaviors, isolating, defiant behaviors, and impulsivity. These symptoms were coupled with a lack of functioning and/or safety concerns. Typical treatment within PHP is comprised of a variety of group therapy sessions, including psychoeducation groups, process groups, expressive therapy groups, exposure groups, and specialty groups specified towards substance use, eating behaviors, body image, and LGBTQ opportunities as a way to tailor treatment for each patient's needs. Group therapy for an adolescent population can be highly beneficial due to the gathering of members to work towards a common goal, share, empathize, and challenge each other in order to create more functional patterns of living. Given the developmental stages that encompass adolescence, peers are an integral part of relationship building skills, identity formation, connection, and growth. Due to the uncomfortable and often seemingly intolerable experience of unpleasant emotions, patients will benefit from yoga as a mindfulness and regulation intervention. The purpose of this literature review is to support the use of yoga as a means to improve mind-body connection and aid in patient healing. In recent years, mindfulness has become a part of many styles of treatment following the work of dialectical behavioral therapy modules. Yoga is a beneficial adjunctive treatment modality given its call for mindful practice and dedication to here and now body awareness. Those practicing give attention to body posture, position, breath regulation, and mindful awareness of mind and body. In recent years, there's been a shift in the understanding of yoga as an intervention for mindfulness and mood regulation. Patients can begin to experiment with sensations and presence within their own bodies and ask questions like, will taking a deep breath relieve the tension in my shoulder? If I focus on my breath, will the discomfort subside? Patients can approach their bodies and minds with curiosity rather than fear. Yoga encompasses an opportunity for adolescents to continue their growth and awareness of their body and mind. Dr. Bessel van der Kolk supports that yoga is an effective way for patients to rebuild a caring relationship with the self again. He also reports that yoga affords patients an opportunity to regulate arousal and combat the physical tolls affected by the intense emotions and stress they experience. Attention on the present moment and breathing from moment to moment is a factor in the success of yoga as a psychological intervention. Dr. Besser van der Kolk found that yoga positively influences heart rate variability, abbreviated HRV, which is the lack of coherence between heart rate and breathing. HRV dysregulation results in negative effects on cognition, emotion regulation, and how well a person is able to respond to stress. HRV is connected to the autonomic nervous system and its abilities to influence control and arousal. Heart rate variability is connected to physical health as well as mental health. In addition to HRV, yoga also affects digestion, sleep-dream cycles, and works to regulate hormone secretion. At my internship site, patients follow a 4-week rotating curriculum that includes a group dedicated to mindfulness. Within this group, it was my intention to combine yoga within the group setting. The implementation of yoga as an adjunct intervention to talk therapy creates a mirrored physical experience to replicate the challenging, rewarding process of regulation and here and now awareness. Due to the hospital setting and to accommodate patient needs, safety, as well as sanitation, patients would participate in seated, chair-based yoga to allow for optimal patient participation. In a study done by Melville, Chang, Kulgiri, Marshall, and Chima in 2012, they found that chair-based yoga was capable of producing acute improvement in the psychological and physiological condition of their patients. Patients for this intervention would be chosen randomly and asked to participate based on case manager recommendation to participate in a 1-hour group that would utilize yoga. Patients will be asked to complete a series of chair-based yoga positions in order to elicit the benefits of yoga. Each position would be held for 8 full breaths before a slow transition into the next position. The positions would follow a series created by Cassandra in 2019 entitled Gentle Chair Yoga for Beginners and Seniors. Baseline and post assessments would include an 8-point Likert scale rating of anxiety, depression, and irritability. Patients would also be welcome to identify a current emotion they are feeling and open feedback regarding their experience in the group. Pre and post intervention Likert scales would be compared in order to assess if there was significant difference in patient perception of mood. Unfortunately, due to the effects of COVID-19, I was unable to conduct this group with patients. However, on the right, we have a breakdown of the group structure I would have implemented. It would begin with a 5-minute check-in for group members, followed by a 5-minute of initial self-report assessment for baseline measurements. The next 5 minutes would be a discussion of group expectations, followed by 10 minutes of discussion of yoga and mindfulness, both the benefits and the limitations. Then the 20-minute series of chair-based yoga sequences, concluding with a 10-minute rest, and to wrap up a 5-minute post self-report assessment. This concludes my presentation. Thank you very much. Please stay safe and stay healthy.